So unfortunately, breast cancer is very common, amongst Australian women these days, and 1 in 8 people will sort of be diagnosed with breast cancer in their lifetime. And I think there's certainly more of an expectation that in this sort of cancer process that we actually offer the option for reconstruction, because obviously understandably patients want to feel that they can return to their normal physical outlook, that they feel that they are overcoming the whole cancer process. So I think there's more and more emphasis on offering reconstructive process as part of the breast cancer treatment. So I think if we break it down into the reconstructive process, again, in the majority of setting, we like to offer that in the what we call immediate setting. That is when the patients are undergoing their surgery, either the mastectomy or sometimes with the wide local excision, that we offer, like an immediate process together with the breast surgeon. That basically they may have the breast removed and then they wake up with a new breast, and that's the ideal process. But sometimes because of various factors, maybe from the cancer perspective or from the patient, medical history perspective, that immediate process cannot be facilitated, then patient may come back later on after they complete their cancer treatment to have what we call a delayed reconstruction. It is still quite common, but often I think from our perspective, the aesthetic result is always a little bit better with the immediate setting. So as much as possible, we really like to offer that opportunity for an immediate reconstruction at the time of the breast cancer resective surgery. And I think if we break it down into two very simple concepts, we can certainly recreate a breast using a silicone implant, which these days we're up to the 6th-7th generation of silicone implant, which has been proven to be safe and well used across the world. The saline implant, which was once something that was available in the market, isn't something that really is being used anymore. So silicone is definitely the choice, go-to choices if we're going to use a different if we're going to do what we call a prosthetic sort of reconstruction. And sometimes we generally these days, if we can, we just basically put the silicone implant in straight away. But sometimes again, like if there's very reasons or patient expectation of the sizes that they wanted to achieve, then we may put in something called a tissue expander, which if you think about it in a simple concept, is like a small balloon that help to expand the skin to the size of that we wanted to achieve. Then you'll come back later on and then exchange it to the definitive implant. So that's with the implant reconstruction. But most of the days, or most of the time these days, we especially for younger patients, we like to be able to offer what we call autologous reconstruction, and by that we mean using your own tissue. And the number one go-to places for you're using your own tissue is using the tummy tissue, which often give the additional benefit of improving that lower abdomen contour as well. Little sort of side benefit, but that's the area that most people will be able to find a small amount of tissue that we can use to be able to reconstruct the breast, and that means using your own tissue, which will grow with you and changes with you as you continue on in the future. And so you don't need to consider coming back later on to have the implant exchange, because implant is not permanent, unfortunately. So I think it is becoming more and more common that people or patients do choose to use their own tissue because of that additional benefit, even though it is a bigger surgery in the beginning. Sometimes if you don't have any tissue available in the abdomen area, we might look at the inner thighs, or sometimes we can even go to the lower back if need be to take the tissue that we need. But they are the sort of, the very simple concept in terms of the timing of the reconstruction, as well as the types of reconstruction that can be offered.